These are the upper extremity dermatomes, C4, C5, C6, C7, C8, and T1.
These are the upper extremity myotomes, C4, C5, C6, C7, C8, and T1.
This is the upper limb tension test. The patient is supine. Depress the shoulder. Second, abduct the glenohumeral joint to 110 degrees. Third, supinate the forearm and extend the wrist and fingers. Fourth, externally rotate the glenohumeral joint. Fifth, extend the elbow. And sixth, add neck lateral flexion. This test is looking for peripheral nerve injury. Babinski test. They use a blunt device like the handle of a reflex hammer and scrape it up the bottom of the foot. This is looking for an upper motor neuron lesion. This is the Oppenheim test. The patient is supine and the position of the examiner is at the patient's side. The blunt object is run along the crest of the anteromedial tibia. This is testing for an upper motor neuron lesion. This is the cervical compression test. A positive test is when the patient experiences pain or reproduction of symptoms in the upper cervical spine. This is the Sperling test. Reproduction of symptoms radiating down the patient's arm is a positive test, and this is testing for a nerve root impingement. The cervical distraction test is used for compression of the cervical facet joints and or stenosis of the neuroforamina. A positive test is relief of the patient's symptoms. Vertebral artery test is looking for an occlusion of the cervical vertebral arteries. A positive test is dizziness, confusion, nystagmus, unilateral pupil changes, or nausea. The shoulder abduction test is looking for a herniated disc or nerve root compression. A positive test is a decrease in the patient's symptoms secondary to decreased tension on the involved nerve root. The brachial plexus traction test is looking for a brachial plexus neuropraxia. A positive test would be reproduction of pain and or paresthesia symptoms throughout the involved upper extremity.
Adson's test is for occlusion of the medial cord of the brachial plexus. A positive test is if the radial pulse disappears or is markedly diminished.
The Allen test is looking at the pectoralis minor muscle compressing the neurovascular bundle. A positive test would be a disappearance of the radial pulse or reproduction of neurologic symptoms. Brace position is looking for a blockage of the subclavian artery by the costoclavicular structures of the shoulder. The positive test is the disappearance of the radial pulse. Outlet syndrome of neurologic and or origin. The positive test would be inability to maintain the testing position or replication of sensory and or motor symptoms in the extremity.